The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with Inside JACC, and I'm talking at the moment to Dr. Marco Merlo, and Dr. Merlo is a cardiologist at the University of Trieste, and he's published a very interesting paper in JACC that deals with the possibility of reverse remodeling in patients with idiopathic dilated cardiomyopathy. Tell us a little bit about your study, Dr. Merlo.
We evaluated a large cohort of idiopathic dilated cardiomyopathy patients from 1988 to 1997, and with long-term follow-up, at least 10 years. And we evaluated them at baseline and after 2 years. And we defined the left ventricular reverse remodeling as the increase of left ventricular ejection fraction of 10 % or its normalization, and a reduction of left ventricular end diastolic diameter of 10% or its normalization. And we found that about 1/3 of our patients showed left ventricular reverse remodeling after 2 years, and this patient, with respect to the other, had showed lower cardiovascular events in the long term. Not only, but left ventricular reverse remodeling, when added to baseline prognostic model, showed incremental addictive prognostic power for predict death and heart transplantation, and also for secondary endpoint pump failure death, heart transplantation, and also for sudden death.
Well, it's pretty impressive. Almost 1/3 of the patients showing reverse remodeling. What do you attribute this to? Were these patients who were acutely ill, some of whom rapidly recover, or were these chronically ill patients?
They showed the reverse remodeling in 2 years of follow-up. The restoration of symptoms is, we can see the restoration of symptoms within 6 months. But the clinical laboratory improvement of left ventricular ejection fraction and diastolic diameter is probably due to ACE inhibitors and beta blockers on tailored dosage. And then these patients with probably a severe disease at enrollment, but with reversible cardiac damage, can tolerate high dosage of ACE inhibitors and beta blockers.
Okay, so I guess the $64 question quickly is what happens to these patients over the long term that have reverse remodeling? Do they stay reverse remodeled, or do they ultimately succumb to progressive disease?
They stayed on reverse remodeling for 7-8 years, and then they have a trend to heart failure and to decrease of left ventricular ejection fraction.
Well, these are very interesting data. I think most of us have this idea that a patient with severe idiopathic dilated cardiomyopathy is not likely to improve very much, but what you've shown us is that a significant minority of them can have some substantial reverse remodeling, and they do much better. And of course, if they remodel, they may no longer fulfill the criteria for ICD. So very interesting information, even if in the long term, ultimately, the patients do develop heart failure. Thanks very much for being with us. For Inside JACC, I'm Tony DeMaria.